Welcome to Season 1, Episode 3 of Beyond Boundaries, the Action Lab podcast, where we delve into critical aspects of reproductive health. We are your hosts, Dr. Kim Baker and Dr. Robert Hammerberg. And today we've got a lineup of insightful interviews featuring experts who are making a difference in the field.
In our Faculty in Action segment, we are honored to have Dr. Christine Markham with us. Dr. Markham is not only a seasoned professional, but also a professor and the chair of the Health Promotion and Behavioral Sciences Department at UTHealth Houston School of Public Health. With over 25 years of experience in child and adolescent health promotion, Dr. Markham has developed and evaluated multi-level interventions in adolescent sexual health, childhood obesity and prevention, and chronic disease management. Her work extends to diverse populations, and she's a trailblazer in utilizing technology to enhance the reach of evidence-based interventions. We'll be exploring her groundbreaking work and experience in today's Faculty in Action segment.
Welcome, Dr. Markham.
Oh, thank you so much, Kim. Really great to be here. Thank you.
So, Dr. Markham, we like to start off our interviews with the root of all questions, which was how did you get started in public health? And most importantly, we asked the question, tell us, did public health choose you or did you choose public health?
Wow, I think that's really funny because I always say I kind of fell into public health, so I guess it did choose me. My undergrad and my master's degree are actually both in anthropology, but more specifically archaeology. So I actually spent the first part of my life, 6 years, as a card-carrying archaeologist. I worked salvage archaeology up and down the East Coast of America, working Native American sites, historical archaeology sites. I worked on sites in the Middle East, in Western Europe, Eastern Europe. So I was loving, I was going to be the next Indiana Jones, right? So I even enrolled in the doctoral program at University of Pennsylvania in Western archaeology, of all things. So, but UPenn is pretty expensive. It's Ivy League. So as any good struggling graduate student, I took a second job, right? So at nights, I was working at the UPenn teaching hospital in their emergency room. And I was doing surveys with young people about this new virus that they were just getting concerned about, which was HIV, so human immunodeficiency virus. So this was the late 80s, and it was really clear that HIV was going to be something, pretty big. So by day, I'm digging holes in the ground and having a great time and loving that. And then at night, I'm having these really intimate conversations with young people about their sexual behavior, about their knowledge, their attitudes about HIV and everything. And Kim, it was like, wow, just the myths, the misconceptions, the risky behavior. And I'm like, wow, this is very real. This is very now. It's not 2,000 years old like my archaeology was. So I'm like, I need to be a part of this. This is something that I need to do. So I went to see my advisor. I'm like, I love archaeology. That's great, but I'm out of here. I've really found my calling. And so for the next 30 years, the whole time, that's really been my life. Adolescent sexual reproductive health has found me. So definitely public health chose me.
Wow, that is amazing. First of all, I never knew that story.
You didn't know that
story? No.
Never, no.
And what's really funny? One of my colleagues, one of my doctoral student peers, I saw her on National Geographic. She was excavating some Mayan temple. I'm like, oh my God, that's Leah. That could have been me. But I have no regrets.
Listen, and public health is happy for you. We are so grateful
I'm happy for it.
to have you, but that is a phenomenal story. And so to follow up with that, because I can say as a student who trained under you, as a young blooming public health professional that trained under you, still training under you, still watching
please.
You, right?
The student becomes the teacher and the mentor, Kim.
It is, I can still hear, and we all can hear, and I'm sure you all hear in podcast land, the excitement in Dr. Markham's voice as she talks about the story about how she fell into public health. Mm-hmm. And so this next question, it's going to be hard for you to answer just in kind of one thing, because I know all the things about the work that you're doing and have done. But it is interesting to know, like you talked about, excavating indigenous lands and sites, and I think about the work that you've done for Native youth and indigenous youth and sexual health. But tell us from your perspective, what is the one thing from your current work that is exciting you, in particular around sexual health? This episode is dedicated to the advancement of sexual health and maternal health. So tell us, what is exciting you about that work right now?
Yeah, so I just really love working with young people. I love their energy. I love their creativity, their enthusiasm. So for me, that's just always been the drive. And so the work that we do currently, for the last 10 years or so, we've been working with colleagues in American Indian, Alaska Native youth. So I love that we are the Healthy Native Youth Collaborative. We work with colleagues in Alaska, Pacific Northwest, Arizona, Southern Plains. And that work to me is just awesome. The weaving cultural strengths into online resources for youth. And young people, if you give them the skills, you give them the tools, you give them access to the resources and get out the way, they're going to make the healthy, responsible decisions for them, right? I mean, we're just about guiding. As adults, all we're doing is guiding and supporting. So we've had the privilege of co-learning. And this goes back, I guess, to my anthropology background as well, because we all know culture is so important. And Native identity, Native pride, cultural traditions, strength-based programming, all of that holistic programming. We've been developing online resources and materials for youth, Native youth, working with Native youth to develop those messages so they're engaging, they're relevant, they're empowering. To me, that's what really, really makes me excited. And then the other project that we have, which Kim Baker is very familiar with, is an awesome new project here in Houston. Reaching young people where they're at, where they're actually living. So working with housing projects to meet youth where they're at to get sexual reproductive health to them, evidence-based, medically accurate programming, working with undergrads, freshman undergrads, let's get the message out to them. So just really trying to meet young people where they're at to make sure that they have the tools and the skills and the resources that they need to make their own decisions. And Kim, you have been my mentor in this journey for many, many years, and I'm forever grateful about that too.
Just this summer, we're at a conference in DC. We're networking with federal grantees from across the country about how we incorporate equity in our sexual health programming, and met a young woman from New Mexico who was excited about being a new grantee. And she was on the panel about equitable practices. And she mentioned the Healthy Native Teen Network as like, this was a resource. And I had to go up to her afterwards. I was like, oh my God, I know those folks who developed that tool. Yeah. She was so grateful for it and thought it was so valuable. So I just wanted to connect the dots. That was just a couple months ago. And so thank you for that work. And we're glad that you continue to be excited about it.
Yep, of course.
Yeah, you touched on it. I was going to ask you, in what ways, surprising or not, has anthropology showed up in the work that you've done?
Well, that's so funny because when I think I first came to UTHealth back in 1992, so I'm a long-termer. I've been here 30 years, but I came with my master's degree in anthropology, and I was interviewing to be project director for a new sex ed program in high schools here in Houston. Guy Parcel, who would then be our dean, had a new project funded by CDC, and we were developing this Safer Choices. It's now a nationally recognized program. And they asked me in my interview, so how does anthropology fit with it? So absolutely. I mean, it's that holistic health. It's that, everybody's own interpretation of health. People have traditional healings, holistic health. I think that perspective and CBPR, I mean, we use all these acronyms, but working with youth, they're the recipients of the program, they're the developers of the program. So I think cultural anthropology just gives you that bigger holistic sense of making sure you're inclusive, having all perspectives, not just being focused on physical health, it's bigger than that, and the just everything that you can roll into that. So for me, I didn't realize it at the time, but it was actually a perfectly natural fit. And it's so funny, when I was even in archaeology, I remember back in the day, some of my peers that were cultural anthropologists, they were like, why are you in archaeology? You don't seem like an archaeologist. You seem more like, like come over to these classes. I'm like, yes. So again, people found me. I don't think I ever found it myself. Yeah.
Oh, that's awesome. You've got so much going on, Dr. Markham, and there's so much that you have done. I wanted to ask a question, a two-pronged one. One, if I'm a current student here at UTHealth Houston School of Public Health, whether I'm in a master's program or doctoral program, how can I get involved? If the stuff that you're speaking to today resonates with me, how do I plug into that work that you're doing? And then the second prong would be, if I'm an alum out in the community right now, how can I contribute as a member of the alumni community to the efforts that you're doing?
Yeah, awesome. So I would absolutely say, if you're interested in adolescent sexual health, reproductive health, anything youth oriented, please send me an email, drop me a line. My door is proverbially, always open. But we have practicum opportunities, we have ILE opportunities. Shameless plug, we teach the course Adolescent Sexual Health in the spring semester. Dr. Baker is always a fabulous guest lecturer. So if you want to know more about adolescent sexual health or become a youth advocate, please take that class, come along, join us there. And then if you're an alum, I would say, please, we love hearing and staying in touch with our alums. So again, drop us a line if you're thinking about a doctoral program. I get, now is the time for doctoral student applications. I'm writing letters for folks. If I can help you with your doctoral application or other programming that you want to pursue further work in public health, I'm always happy to support that. But if you're an alumni, if you have practicum opportunities or you have ILE opportunities, or you want to get involved as a youth advocate, please, again, just shoot us a line and we'd be very happy to talk, very happy to talk.
On that note too, a lot of the work that you're doing is out in communities. And so I'm curious too, if you have volunteer opportunities for individuals who want to, contribute their time to the cause.
So technically we don't have volunteer opportunities, but I could hook you up with community organizations that might need extra help. But through UT, we can't necessarily do volunteer projects. Yeah.
Awesome. Thank you.
Awesome. Okay. So final question. And so thinking about everything that we're facing, youth are facing, communities are facing, really in terms of the state of sexual health and reproductive health. So what, from your perspective, do you think we need to do? And you can say as a city, a nation, a society, from whatever vantage point, what do we need to do to go beyond traditional public health? And to transform kind of just how you mentioned this holistic view of health so that it's attainable for all? Like, what do you think needs to happen?
So the biggest one is just get out and vote. I think, voting so much we're seeing in the last year or more, what we do with our own bodies, what we do in terms of sexual health education in schools, access to resources, everything. It's voting at the local level, it's voting on your school board, it's voting at the state level, it's voting at the national level. So just citizen engagement and being an advocate for youth. And then the biggest thing I think also is just that adults need to get out the way. We need to be a support for youth. We need to, like I said, give them the tools, the skills, the access, and then get out the way. So adultism, ageism, I think, we don't really put our faith in young people, and they have the vision, they have the energy, they have the creativity, they have the persistence, they have the endurance. So we need to be a support. To me, that's about. And for us, giving back, making sure that we're giving the frontline teachers and healthcare providers the tools they need to help youth. But get out and vote, and then be a youth advocate, and that's the way, hopefully, we can see some of these things move and come to fruition.
Get out and vote and get out of the way.
Thank you. That'll be the tagline for this episode. Thank you. Thank you, Dr. Markham. Did you have a follow-up, Robert?
Oh, I wanted to turn it to you too, Kim, because you also do a lot of work in this field and are an expert in your own right. And so I want to know too, how would you answer that question? and complementary to what Dr. Markham said?
You know, I would lift up the engagement, get out the vote, get out the way. I would also, I heard something this summer that I cannot let go that was so transformative for me. It was a woman who was, she is over a nonprofit in the South and does work in sexual health and maternal health on a community level. And she talked about what her organization needed to sustain themselves in these times, that they're getting requests from all over, education, access to resources. And she had shared that many times the funds that they get don't fund joy. And she said, fund our joy. For so long, you funded our pain. And so fund our joy for our communities to transform and step into this like wholeness of themselves and wellness in a new way that feels like well, like you are well or you will be well. And that I just said, goodness. And so I've been carrying that, like, how can we do public health in a way that uplifts joy for people, right? And I will not, we kind of chatted a little bit earlier for podcast land. I experienced the Renaissance concert here in Houston, and Beyonce, if I can say joy in that weekend with Beyonce performing in a diverse crowd of 50,000 people in the largest, city in the South, the most diverse city, like the joy that was there. And so just thinking about how traditional public health can transform some of our workings to where, we may not get a 50,000 attendee crowd like Beyonce, but there are initiatives that we can bring more joy to. And so that's what my answer would be.
Yeah. Fabulous. We need, strengths-based joy, unity. Yeah, fabulous, Kim.
And Kim, as an outsider looking in, I would argue that you do that through Own Every Piece.
We try, and we're trying to do more of it. You have to justify the joy, so that's what we work to do as well.
And the positivity, it's about, it's your choices and positivity and strength and pleasure and love and joy and all those things and health. Yeah, wellness. Yay. Beautiful.
Yes. Thank you so much, Dr. Markham. It was so great speaking with you. I kind of turned back into a student a lot of times. I'm like, Dr. Markham. And for all the students, I know for the students who are listening, I know she can't be the advisor to each and every one of you all, but I will say she is an advocate of the student experience. And so just as in her work, when she talks about adults moving out the way, I really do think that, Dr. Markham, that it's fitting for you to be the advocate that you are for students here at the school. And so y'all don't hesitate to reach out to Dr. Markham, just if you want a word of advice or just to connect and say hello. Please
absolutely, do. Absolutely. Thank you so much, Kim and Robert, for the opportunity. Really appreciate it. Always great to talk to you both too.
Moving on to our Community in Action segment, we're joined by Dr. Grace Loud, Assistant Professor of Social Work at Texas Southern University, and Dr. Dominique Guinn, Assistant Professor at Texas Southern University, and recipient of the 2020 Empowering Community in Action Grant, which she received funding to address the impact of HIV among a very vulnerable and marginalized community, including Black and Latinx gay and bisexual men and other men who have sex with men, transgender individuals, and Black women across Texas. Together, they share their experiences and insights into community-based approaches to reproductive and sexual health.
We're so excited to bring to you episode 3 on the topic of sexual health. Many of you, if you know me and my work, this work is near and dear to my heart. And so to be able to interview and feature some amazing work that is happening with our community partners and work that is happening in and around communities, that's what we want to share with you today. And so we're excited about our guests for today. So we are joined today with Dr. Grace Loud and Dr. Dominique Guinn from Texas Southern University. So thank you all so much for being here today.
Thank you.
Thank you for having us.
Absolutely. And so how we're just going to go through this, I'm going to first ask you a question that we always ask our guests because it's so interesting and we love to kind of hear the story behind it. No pressure if there's no story behind it. That's okay. But we're always interested in how you got involved in this field of health or public health, right? Mm-hmm. And so that first question is, did you choose public health or did this field choose you? And who wants to go first?
I'll let Dr. Guinn go first.
And I'm going to say public health chose me. And I'll give you a little background, but I took a position with the Arkansas Department of Health as a disease intervention specialist. And anyone that was working in a supervisory position a little bit later on, they required you to get a master's in public health. So that was kind of my field to public health. However, backing up a bit, I'm a communications major. So I thought I was going to be a radio or television broadcaster. I was too heavy for television. And at that time, they told me for radio, my voice wasn't right for radio. So kind of in the dumps a bit.
Pause. I'm sorry.
I'm being politically correct, Dr. Baker. My voice, it was an urban radio station. My voice was too white for urban radio. I'll just be honest.
No. So wrong. They were wrong. Okay, continue with your story. Go ahead.
So I was a little, disappointed at home. And my dad said one morning, a job's not going to come knock on the door. So you've got to find it. And he helped me a bit. He had friends working in for the state, and he'd always ask what positions were available. So he found me a job. And with that job, the first one was the Department of Human Services. And I was doing food stamps and adult Medicaid. With adult Medicaid, I kind of had a knack with documentation, and I started doing all the applications for the medical review team. And at that time, it was persons living with HIV that I did the bulk of the applications. And I met a woman 25 years ago who was thriving with HIV, and everyone else that I had seen prior to was not. So it was just the curiosity from that. I remember I started talking to the DIS who was working at that time, and he'd always have this interesting story. And y'all, when he left, I applied for the position, and yeah. So public health kind of chose me.
Yeah, and the rest was history, huh? As they say, right? So if I could just respond, you first of all, you have the voice for any radio. And so
30 years ago, it wasn't Black radio.
I know, right? So just kind of thinking about those things that happen in our journey, that when we reflect back on it, you're like, wow, and kind of where you're at. And then don't even let me start on the I think you said something about somebody told you were too heavy for TV. And so like the body shaming and all of that. Like, so like, that's another issue, right? And I feel like even in the field of public health, there's some gaps and there's some needing for equity attention on those things. So thank you for sharing that. Yeah. Awesome. What about you, Dr. Loud? Did you choose public health or public health chose you?
I would have to say it chose me as well. Before the phrase public health, that's our fancy phrase. But back in the day, when I was younger, I just realized what caught my attention was that I never, or I should say the girls and we were with our family, we never talked about sexuality. It was the taboo of it that kind of got my attention. And when you're in the 6th grade and you've got friends who are pregnant, and pregnant, not just from another person, another student, but a grown person. And nobody's talking about it. No, even still, no one's saying anything. We're just acting like we don't see it, or we just kind of ignored her. And then my friend, one day she's just gone because she had to go have the baby and she never came back. And then seeing things in families where you have inappropriate engagements among family members and people put it under, just kind of duck their head and act like it never happened. And I'm just like, why is it okay for these things to happen and no one's saying anything? The most I would ever hear anyone say is, well, don't bring back a baby. That was about the extent of it. So I always knew that there was something around the lack of communication around it, but yet and still everybody is, you're thinking about it, or you want to know more about it, or you go places and you experiment. Those types of things just always resonated. I was curious about those types of things. And so as I got older and I realized that we were missing out, I missed out on a lot in terms of communication. Imagine where we'd be if we'd had better conversations, open conversations. And when I started to learn and do my own spiritual path and seeking, and I realized that the role of what I believe sexual health to play in so many other dimensions of our lives, it just became even more important to me that wholeness be achieved in that respect. And so I kind of, and I was the first person in my family to go to college. So there really wasn't anyone to kind of ask in terms of navigating how to make your passion your reality. But I just kind of took the circuitous route and did my best. So here I am. I made it into my doctoral program and I know what I'm interested in. But there's no one in my circle, or I should say in your academic circle of instructors, who's interested in the same thing that I'm interested in. But I'm like, I'm going to commit and I'm going to stick with this topic. I may have to adjust a little bit, but I'm going to stick with this topic. So I realized then my commitment when I was willing to stand in the space alone and say, I'm going to push for what I think is important. So that's why I say I think it chose me, because it's just sticking to what I believe to be important. I know that there's some value in it. I know I'm not the only person that have had these types of experiences. And so there has to be something to it. So I'm going to continue that journey in now what is public health around sexual health.
No, thank you so much for sharing that, like both of y'all, in terms of like why I chose you. And I just wanted to reiterate, just so the listeners can maybe pick up on this piece of why sexual health, I guess, unique in a way because of the stigma, because of the taboo, that those of us who choose this path, sometimes it is something that chooses us because we can't get rid of that passion to want to change or to ask those questions or to kind of understand, like, why wouldn't everyone want this wholeness for everyone, right? And how do we get there? And so whether it's you, Dr. Guinn, talking about the work that you were doing that wasn't necessarily public health, but seeing the connection, especially for those who are surviving and thriving in the early phases of the HIV pandemic, right? And then you, Dr. Loud, with the community and family stories and that piece. It's so very tough. And it's something that sticks with us, I think, in the topic of sexual health today, like trying to make people know that this also fits, that this is also that much more important.
Yeah.
I would add too that, especially Dr. Loud, you shared a lot of things that what resonated with me was just the fear that can be associated with sexual and reproductive health. A lot from the unknowns, how taboo it is, not talking about things. If the only sexual health message you're receiving is don't bring home a baby, then that right there is setting up a world of fear.
Especially if you don't know how they get here.
Yes.
Yeah.
And then even the fear that you experience with, in some ways, in shapes and forms, you may not call it that, but as far as standing in your own space as a researcher in a space that nobody else is doing work in or the same work too. So, I commend you for sharing that piece. So, I'd love to ask too, if you could share a little bit about the work that you're doing now in the space of sexual and reproductive health. And as you do that, if you could share one thing about your current work that excites you.
Well, what excites me right now, no doubt, is the work that Dr. Loud and I are doing with TSU Shape Initiative. And as she said, sometimes this is, kind of lonely work. You're oftentimes not supported because sex is still very taboo. But what excites me now is where we're going. The sex positivity, things, a lot has changed in the last, let's say, 25, 30 years. Um, you know, we attended USCHA biomedical prevention last
Mm,
spring,
mm.
but the overwhelming message is sex positivity. Supporting people in whatever it is that you do, you like, but supporting you. And that's truly what it's about. So that's what excites me, engaging with students, engaging with the community, and where we're going. And Dr. Loud can,
Oh,
yeah.
yeah, I agree. Dr. Gwen and I joined forces, but Dr. Gwen's been in the game for a long time, and so we joined forces about a year ago and tried to kind of merge our experience and our knowledge together to see how we can push this forward. Dr. Gwen came with just an infusion of ideas and passion and I'm just like trying to hold on, but I'm excited and I'm going to hold on. I'm just grateful because our brand is building itself. People are learning who we are, what we stand for. They know that they can come to us and there's no judgment. We're going to that's what we and that's one of the things we pride ourselves on because we do want to be culturally affirming. There's no judgment. So you come as often as you think you need to come. And the people that we bring in and we're trying to work together as a team, it's about nurturing. We think that nurturing will get you to a healthier state as opposed to feeling ashamed or embarrassed. So we're excited about that because the students in the area as well as people in the community, they're recognizing if it's not the shirt or the logo people can change, but the program is building its brand. And I'm super excited about that because now I want us to be known for, this is just a place to go if you want to feel like you're being taken care of.
She's very humble. She's been building this brand since 2014 and has done an amazing job. I am coming in. Yes, I've been in this field a long time, but as in terms of research, I learned so much from her. And I feel like my weaknesses are her strengths. It's been a fantastic partnership. And I think the sky is the limit for what we will do with TSU Shape Initiative.
Awesome. So just a follow-up question, because something you mentioned, Dr. Gwen, about a recent conference. If you can share a little bit more. You mentioned, I think it's the U.S. Conference on HIV and AIDS. I kind of wanted to give our listeners kind of like what that was. And you mentioned, which is a highly sought after conference, a lot of experts attend, but you mentioned that the focus this past year, you heard a lot on pleasure and body positivity. Could you speak to like how important that is about kind of where we're at in the work of sexual health and public health?
Absolutely. And it was actually biomedical prevention conference where, of course, the focus is PrEP. And that was, I think this is maybe last year was the third year of the biomedical prevention conference. But again, the theme and the focus was body positivity. And Dr. Loud can tell you, I was so excited. And when I came back, I was like, I heard this thing and I think it's game changing. But it is game changing because, and it goes back to what we said, the stigma around sexuality, the taboo around sexuality. And so I think body positivity is this movement, the one that will kind of, as I said, change the game. And it is, how, as Dr. Loud said, we are affirming and accepting of whatever. What we teach you how to do is to be healthy. And I think that's what body positivity is about all around. Just, giving you the tools, because we've got everything in the toolbox. So we've got PEP, we've got everything. So getting that out there, that translational science piece, taking it from, the lab to the community. Mm-hmm. But I feel like spreading that message it's just going to be game changing.
This conference was wonderful. They titled it, Dr. Gwen got us their love letter to Black women.
Yes.
And that was just divine to see all of the different viewpoints and the levels of exposure. And I mean, they really went all out in bringing the influencers to come and kind of like just, it was wow. It was amazing. amazing.
And Dr. Baker, you asked, so National Minority AIDS Council has two major conferences. It has been doing a U.S. conference on HIV/AIDS for long as I've been in the field and long before me, so more than 25 years. But in the last 3 years, and our local Danielle Houston, when she was working for NMAC, that was actually her baby, the Biomedical Prevention Conference. But they are the two major conferences, in HIV work.
Thank you for sharing that. So we also like to talk a little bit about, or have our guests share a little bit about how students could get involved in this work that you're doing. So please do share. Do you all have opportunities that students can be engaged, and what might that look like? How often?
Absolutely. Yeah, we have opportunities. Students can sign up to go through training to become a peer advocate. Peer advocates are like they're formally trained within a certain set of our curriculum, if you will, and then we provide them with the resources and supplies to be able to engage their social networks. And then they commit to a certain number of hours. They can set pretty much just a general number of hours that works for their schedule. And then when they finish as peer advocates, we try to make sure we give them some like tokens, if you will, a letter of recommendation, a certificate. So because we know that they're working to build their resume. So this can be for students and also for community members who are interested in joining the cause and being a source of support. We offer internships. So more formalized internships. So like we have our social work students, we've had health administration, graduate level students. We've had students from Prairie View. We offer support to the students at the University of Houston for their internship needs. What else? We also have a campus org called the TSU Shapeshifters. And so they are responsible for kind of hyping it up and getting out there on campus and just doing the fun things that they like to do around sexual health and wellness. So those are just some of the ways that students can be involved, but everyone is welcome. If you're interested and you have a passion for it, we can find a space for you.
That is awesome. I know we've had some students that worked on our projects that did their practicum with TSU Shape. And so there are opportunities, students, for you all to get involved. And I really like how you mentioned, even if you're in the community, right? And you're really wanting more skills or wanting to like learn more about how you can be an advocate in the sexual health space, then that could be an avenue. Dr. Guinn, did you want to add anything to that?
No. Thank you.
Thank you so much. Well, we love to wrap up with kind of a thoughtful question to leave our listeners with. And it's a little high level, but feel free to pare it down as much as needed. But, from your perspective, if you could give our listeners one word of wisdom on what they should consider and sit with and think about in terms of what they can do to help transform public health and transform the space of reproductive and sexual health, like what would be one key takeaway that you would want individuals we've talked about a couple of different issues in the field and current topics, but what would be one piece of advice that you would give somebody who would be interested in contributing to the change that's needed?
I if I had to just pick something, I'd say start where is most feasible for you. I think it's easy to kind of get lost, and it can be so overwhelming because it's just so many things and so much going on that could be better. But start where it's feasible for you. And if you are a caretaker of someone, make an intentional decision. Maybe you're a caretaker of an adolescent, or you're a good friend, or make an intentional effort to have an honest conversation. I don't know about sexual health, or to validate someone. Or if you want to, get out there and join an organization and create a group. Just start where it's most feasible. No, I don't think any action is too small to contribute to kind of like that snowball of change. That might be the best thing I'd want to offer.
I like that, Dr. Loud. And, I especially think that, with everything, charity begins at home. So starting with ourselves, looking within, or, look at, kind of, we all have to at times check ourselves with how you look at things.
Mhm.
That Dr. Hammerberg, that was a difficult question. And I guess it's piggybacking on what
Yeah.
Dr. Hammerberg said, but starting here and then kind of working out. We know individually what you may deem as injustice or where you think changes need to be made. Never think that anything is too big. So anything that you truly see that you'd like to change, you do have the power to make a difference. Figuring out how, but you got the power to make a difference.
Absolutely. And that is what y'all are doing every day. And so we thank you. We definitely thank you. And in terms of folks getting involved, and so you all will be able to contact, and we'll provide that information when we post the podcast info about ways that students, community members, alumni can get involved with this work, because it just takes one step towards the transformation, and that's really what you need. We thank y'all so much for joining us today and having this conversation. And also thank you for your work that you continue to do and that you're super passionate about, that is so desperately needed. We could stay here for hours, but the conversation continues because there's still more work to be done. So thank you.
Yes, indeed. Thank you. And thank you for your work too, Dr. Baker. You've been in the game for a very long time as well. So thank you for being a role model for us.
Yeah.
Awesome. We're for each other. Thank you.
Yeah.
Thank you. And thank you for the opportunity, Dr. Baker, Dr. Hammerberg.
And wrapping up today's episode is our Alumni in Action segment, which I am excited to announce is featuring our very own Dr. Kim Baker, Assistant Dean of Practice and Assistant Professor. Dr. Baker was interviewed by a few of our fellows through the Action Lab. And in that segment, we'll learn more about Dr. Baker's work, which involves the use of community-based research methods and practice-informed strategies to improve health service delivery. Dr. Baker is certainly passionate about reproductive and sexual health, health disparity elimination, and the impact of racism on reproductive health, which is why we wanted to feature her in today's Alumni in Action segment. So join us as we delve into Dr. Baker's expertise, focusing on contraceptive access, maternal health, bias reduction, and social marketing.
Yes, thank y'all for that introduction. I'm happy to be here.
Yeah, thank you so much for coming and taking your time, Dr. Baker. So as you know the routine, the drill, our first question to you is, how did you get started in public health?
Yes, and so the old, did I choose public health or did public health choose me question?
Yep, that's the one.
So I can honestly say public health chose me. I had no idea to the full extent what public health was. As some of y'all heard in the bio, I was a biology major at Hampton. And that meant really one of two things. You were a biology major, you was going to go to med school or dental school at that time. And so I had my eyesight on being an OBGYN. I was going to do all the things in that field. And this was also around the time where a lot of community work was being done around HIV prevention, a lot of attention in the late 90s into HIV prevention. And so at an undergrad, I got involved in a lot of community activities with local organizations in the Virginia Peninsula, 7 cities area, Hampton, Newport News, Norfolk, Portsmouth, and start working with a woman named Pearlie Jett with the Peninsula AIDS Foundation. And she pulled me to the side and said, Kim, have you ever heard of public health? And I said, the first thing that came to mind, which makes sense and it's still true, and I'm not to discredit public health in any way, but the first thing that came to mind was like, oh, you mean like immunizations and like nurses going out giving immunizations? Yeah. She's like, no. It's, yes, but it's more to public health. And I was like, well, do tell. And so she basically shared that because she saw the work that I was doing in the YMCAs on Saturdays. Me and some of my college peers would spend time doing education sessions with young people and youth. And I absolutely loved it. And I didn't know it was a field. I just thought this is community service. So I love it and I'm going to show up. So when she showed me that, I was probably in my junior year, so really far into this bio pre-med track. And I was just like, no, what does this look like now? I don't know what public health grad school means. All this time I'm thinking about MCAT, not GRE. And so I took a break after my undergrad. I took a year off to kind of prepare for what that transition looked like because I couldn't go right into it, right? And then that year off, y'all, I spent some time in Las Vegas, Nevada, because my mom had moved there. I'm originally from St. Louis, but she had moved there and she was teaching middle school. And she said, well, since you're a year off, you want to come teach? And so I did. And I taught middle school science. But while I was teaching there, I saw the need to implement sex education at the middle school. And I went to the principal and I said, I'm hearing some things and I'm seeing some things and we need some programs for these kids. And the principal was like, well, if you want to do it, go ahead, go right on ahead. I'm not going to stop you, but I don't want to be involved. And so I have really free reign to do those things. But then I start Googling and learning about these programs that were happening around the nation and these awesome curricula. And I was like, oh my goodness, I don't think the schools and the teachers that I work with know anything about this. So that further propelled me to want to go deeper into public health. And I started hearing about public health programs that had a focus on this. So that is what got me on that trajectory. And then I ended up in Houston because I stalked really some of the work that was happening here in Houston at the time with Dr. Tortolero, Dr. Markham, and It's Your Game. And so this was, decades ago. I said, I want to work with them. And so I got really, real intentional, right, about sexual health and how I wanted to show up in that work, who I wanted to learn from, and then how I wanted to give back and make a mark. And so I just kind of give a lot of credit to Miss Pearlie Jett in Virginia, who pulled my coat chain and was like, you need to go into public health. And so I thank her for that.
That's awesome. I think one pattern that, we've been hearing in the podcast is everybody has that one person who's like, have you ever thought about public health? And initially we're like, what is that? So it's really awesome to hear about your journey and to hear, that pattern and that thread that's in a lot of our stories, but the fact that we can still make impact, even if we don't grow up thinking I'm going to do public health. So that's awesome. So the next question, could you share one thing about your current work? You mentioned Own Every Piece and Green to Grown that excites you. Could you talk about what you're doing and the impact you're working towards?
Thank you for that question. So if I can think of one thing that is exciting me about the work, that's going to be hard, but I'm going to try. I think it's the opportunity it's almost twofold. And so there's Own Every Piece, there's Green to Grown, there's the new Center for Collective Action for Reproductive Equity Care, right? Which is the umbrella really for many of these initiatives. But I think it's the opportunity for the work to be shared with our community partners, with other institutions. Because for so long, those of us who work in sexual health and reproductive health have been working, sometimes it feels like fighting, to help to prioritize and normalize the work that we do. When I say normalize, like make it meaningful and an important and a critical part of public health, which we know it is. But sometimes to the lay public, to the public, there's still so much work to do there.
Yeah.
And so I feel like the partnerships that we're forming in my current work mirrors that folks are saying, absolutely, this is critical. Absolutely. With Green to Grown, right? We have Harris County Juvenile Justice saying, we need your programming here. Housing community saying, how can we make this a celebratory experiences for our community that see adolescent sexual health development as critical to just community wellness, right? And so I feel like I'm excited about people being able to say, yes, we want to work with y'all. We're not afraid. We want to push past stigma and shame and do what works for adolescents, for people, for communities.
That is awesome, Dr. Baker. For students like us, public health is very diverse, and those who have common interests, like in maternal and child health, reproductive and sexual health. I personally connect to that topic, and it's very inspiring for students like us. So this leads to my second question. Like, as a student, how can I get involved in this type of work?
Thank you for that question. So the first thing I tell students if they want to be involved in this work is to do their practicum with us, right? Do their practicum with Own Every Piece, do their practicum with our new Green to Grown initiative. And that's really the most tangible way if folks want to really get involved. But also thinking about opportunities just to attend an event that we're hosting, right? Or attend a lecture or attend a webinar series just to learn more about the topic. And so that's very, very, very important and critical for students. I love having the energy of students. I love it. I love to learn from students. I feel like students are, because I can remember once and being in that position. And I also feel like we're forever learners. And so I always want to just well, what are you thinking? Well, you tell me. Does this make sense to you, right? Does this, what needs to happen? And I think that also helps us continue to transform public health, right? So many things that we've done 10, 15 years ago, especially in sexual health, have changed or could be dated. And so we need new eyes, fresh eyes, new insights. I know sometimes students think that, oh, I'm not done, so I don't have the answers yet. I'm learning the answers. No. Everyone comes from special experience, special life experience, unique insight. And so I try to draw upon that. And so for students who do want to do this work and volunteer and work on projects that I'm working on, I'm always looking for those students who are going to ask questions, right, and share their thoughts and don't want to sit back and really just kind of want to be involved. So I encourage all students to do that. Don't dim your light. Ask questions and give your feedback and give your insight because it is truly valid.
Thank you. That's so valuable to hear, especially when students may feel like their voice does not matter or there's no weight to it because of possibly lack of life experience or experience in the field and it being new. So it's very awesome to hear you lift that up in that you and the work that you're doing, students' voices are encouraged. That's really awesome. So moving on to the next thing, after we're students, we're alumni. We know Sai is about to be an alum. I'll be an alum in May. What can alums do to support and be involved with the work you do?
And congratulations, Sai. You'll be graduating in just a few weeks or completing. And Ariana, you are up next. And so congrats to both of y'all. That time just flies by, right? And so once you become an alum, sometimes you're still kind of like, okay, now what it is that what is my role in public health? How am I making my mark? But we really want all alum to feel like they can be a part in this work. Just as I want students to do their practicum with us or volunteer if they can with us, I would want alum to host students, right? Like if you find yourself in the field, particularly, especially in sexual health, maternal health, reproductive health, right? Like reach back and mentor current students. So just, give back. return and stay connected. You know, our alumni community is vast, and that networking is critical. Many of the partnerships that we are exploring now, even in my own work, are with fellow colleagues who were once students alongside me. And so, like, keeping those connections are so rich, and it creates a warmth to this work as well that is so needed. If I can just circle back to kind of how this shift is still occurring to reduce some shame and stigma in the sexual health community. And so, as an alum of work, it's so important to stay connected and networking so we can continue to build our community, continue to help transform the work that we're doing, and know we're doing this among friends and colleagues. That's so important, and it really helps with the challenges that we face in the work.
Awesome, Dr. Baker. That was like, for me, it is so relatable and very beneficial piece of advice, because in the whole field of maternal and child health, sexual and reproductive health, though I've been international students seen in my native country and in America, this field is always being evolved, and staying connected, like with a true passion, is very, very like attitude of a public health professional. So I would definitely keep that in my mind. Thank you so much for that.
Absolutely.
And so just moving on to our next question is, from your perspective, what do we need to do to go beyond traditional public health and transform attainable wellness for all?
Oh, that's a hard question. Who thought of that one? Okay. So there's one answer that's jumping out to me, and it's really connected to how the majority of us came to public health, right? We didn't, like, a lot of us didn't intentionally choose public health. It chose us. And while I love my origin story in public health, I feel like it limits the possibility of public health. I feel like we need to do more to go to a class of fifth graders and introduce public health as a career, and how much change that will occur for 10 years down the line for them knowing about this field, right? And so I feel like to better transform what could happen for the future of public health, we have to do more of that. We have to set up opportunities for young people to know that things can be different. Things can be different in their schools, in their communities, in their families, related to wellness and health. And then they can be a part of that. And so I feel like that would help transform it. I would love to think about how future initiatives can do more to involve elementary school students on a career. I know we talk a lot about high school students, but I'm even interested and fascinated, maybe because I'm the mom of 2 elementary school kids now. And they're asking questions, right? Like, my daughter, Noah, just came home. Well, she's running for student council for her 3rd grade class, right? And like, one of her initiatives was kind of like, making sure the school is clean and everybody is safe, like very public health change. And she knows public health because I'm her mom, but if I wasn't her mom, she wouldn't be able to tie that together. And so I think we definitely have to do more of that so we can, increase, I guess, our rank in the field, just in terms of the number of folks who know about public health and want to go into the field and feel best prepared.
Yeah, I love that. And public health is such a large umbrella, and we don't even realize how large that umbrella is until we get into these spaces. And even knowing the air of social justice, especially for like the younger generation, of wanting to be involved, of wanting to see change and seeing how things are and saying, I don't think it should have to be this way. Public health is a wonderful route to begin to do systems change, which is largely talked about. So before we wrap up, we have our own personal questions for you. And my question is, I'd like for you to walk me through what inspired the Action Lab. Advocate, connect, transform, and where do you see the Action Lab going?
Ooh, good question. So what inspired the Action Lab? Okay. So it started with a couple conversations, right? And so the need to connect students to things that were happening in a community in a very open way. When I say open, like without the Action Lab, students can do things in the community on their own. They may already be doing work in community, or they may meet one of our faculty members and get excited about their work and get connected, right? So we knew that there were vehicles, but then we also felt like it wasn't an equitable pathway. Like you either had to already know or be connected to faculty to be able to do that, or what have you. And so we were inspired, and definitely under the guidance of our senior associate dean, Dr. Tortolero Emery, who had learned about what Boston University was doing with their activist lab, right? So not action, but activists, I think, which started in around 2017. And so, and in this activist lab, they were doing some of those things. And we were like, this is awesome. And then they were also having these conversations at the school level around equity and transforming public health, whether it was using an anti-racist lens and really talking about many of the social determinants of health, or if you want to call medical drivers, whatever you want to call non-medical drivers, whatever you want to call it. But having these school-wide conversations around this so that we could create a culture of students and learning and engagement that people felt firm in why they may have chosen this track in public health to seek change, and be supported at the school level to feel it, right? And so we wanted it to reflect. So this is why the Action Lab was thought of, and then why we worked hard to launch it. And then we also saw opportunities to have fellows. And so you all, so I'm so glad that you all have chosen to be fellows. We had 2 inaugural fellows last year who were great. And so we're learning through this process. And so we're looking to continue to build. And so I'm really excited about where our fellowship program is going, because again, we're learning from you all, and y'all's feedback is important, because the work that you will do and with our community partners, we want to learn from that. And then we're also excited about, our initiatives such as the film series, or being able to use documentary screenings as a way to foster conversation in our School of Public Health community that we probably didn't get the opportunity to do before, right? And so to keep topics current, and to keep, I guess, a language of understanding at the forefront of how we see this work, is very important to us in the Action Lab.
Awesome, Dr. Baker. I definitely agree that Action Lab is one of the platforms where a student like us with different backgrounds, clinical, community, or research, we get the chance to apply all what we have learned in classrooms and just transform. And it is indeed an apt name that it is an Action Lab. And for me personally, it has been a great learning curve for the past couple of months, and I enjoyed working with our team. It's one of the friendliest teams I have been with. So it's such an amazing opportunity. And I wish Ariana, since she's continuing with Action Lab for a few more months, so please she's been doing amazing, just connecting with everyone. Please keep doing that. And also, I wish the coming future Action Lab fellows that they could just make most out of it, which is definitely very beneficial for their future. So, I personally have a couple of questions, Dr. Baker. So, being an international student, I just want to put that way of lens to this podcast. So, were there any phases in your life where, since you have been engaged in different fields of public health, where you were a little iffy about what a field I'm going to choose in the future, like while selecting your PhD or while entering your professional experience? How did you overcome it?
That's a really good question. Okay, so it's around fear and what path I'm gonna choose, right?
Yes,
To
Dr.
be
Baker.
honest, that is a continual thing. If I could be honest. And really and truly, early on in school, I never felt like I wasn't sure. Like I knew I wanted to be in the field of sexual health, and I just was that passionate about it. And sometimes it's a gift and a curse because sometimes I've passed up so many opportunities for other topics that probably would have been amazing. I don't know. Or working more in policy or like legislative, the world, right? But it would be very general and it would take me away from this time. And so I know I've had to turn down a lot of things that probably would have been like financially beneficial or like would give me some sort of more presence, right? Or visibility. But it's just my love for sexual health had prevented that. And so that really trumped any fears about which path I was going to take. And it allowed me to be very clear in what I wanted my career to look like and feel like. And so I feel like now it's harder because it's like I'm doing the things that I want to do with the work. And then it's also like, there's something else though here too. Like, what is that? Or like this can go here, right? And so it's learning to discern from like when you need to kind of stay the course with the project or with the job to see it through because you put vision behind it versus balancing like what your gut is telling you, like, okay, it's time to jump and it's time to go. And so for me, in my experience, I've been able to stay the course and learn from that. And then I have this thing I have on my desk where it's like I haven't failed 1,000 times. I just have 1,000 new lessons, right? And so many times students and people, all people, students are people, don't want to move because they don't want the fear of failure. It's not going to work out. I'm not going to be great at this or what have you. And then, but I just see failure as a lesson learned. And so we have to continue to like take that fear away and say, hey, if we do it and it doesn't work out, we learn from that. It's a lesson. Let's learn from that and let's move quickly so we can get to the next thing. And so I think that is probably the way I even still handle like what's next for me. Like I got to take fear out the equation and just move forward.
Awesome, Dr. Baker. It was kind of a little for me, since I'm in that stage of pursuing my next milestone in my life. It is a great insight. And I here want to ask you a little bit of opposite question to my former question.
Yeah.
Since you are one of the most versatile professors of our esteemed UTHealth School of Public Health, involved in many of the projects, let it be
I'm
recent.
versatile.
Yes, you are.
Yes, you are.
Yeah. So, did you ever feel that, okay, now I have followed my passion, I have accomplished enough, what next? Or did you ever feel like, I definitely know you are the person who keep going, who want to establish more. So I just want to know that what are the positive things from your working experience or educational background that keeps you motivating, be involved in multiple tasks, and have that clarity and in each and every field?
Um, what keeps me going? What motivates me?
Yes, Dr. Baker.
It changes. Like before kids, it was just my passion for the field. Like growing up as a young African American person in one of the most desegregated or segregated cities in the country, St. Louis, Missouri is my hometown and where I was born and raised. There have been studies and documentaries on the racism of St. Louis. It was the ground for the Black Lives Matter, the killing of Mike Brown. And so I feel like that will always fuel me. I feel like me knowing that I knew what oppression felt like and looked like and wanted it to be different and things to be different and folks to come together and help make it different will continue to fuel me just because of who I am and my life experience and where I was born. And so, but then becoming a parent adds layers to that because now it's like, now I have to I would say work harder, but be more diligent to ensure that whatever I'm doing is transforming to make things a little better for them. And in a very, very, very intentional way that I don't think I realized before that. And so those are literally the two main things that continue to motivate me is my life experience and then now my additional experience of parenting.
Awesome. I think I asked a lot of questions. If you just keep, don't control me, I'll keep asking you, Dr. Baker. So I'll just hand over to Ariana.
Yeah. Okay. So this will be the very last question, and then we'll close out. What would you have to say to the public health professional who maybe feels like what they're doing isn't enough, that they're not seeing the changes fast enough? What would you say to them in this moment?
Oh, y'all have some really good questions. In this moment, I would say enjoy the holidays. Give yourself grace because I know this will be recorded, so y'all, this is like the holiday season right now. Between November and December. So I would, in this moment, I would say give yourself grace and enjoy just yourself and celebrate. I feel like so much of our work, because it is for the public good, because it does have a social justice mission and foundation behind it, you can get caught up in feeling like you're not doing enough. And whatever you're doing is not making a big enough impact, right? Because there's so much to be done. But we have to move away from that very individualistic mindset because unknowingly, that's what we're doing when we put all that weight on ourselves, right? We do what we can. We take a break. We celebrate the small wins. Sometimes the small wins is getting through your to-do list for that day or that week. And we just keep pushing, right? But we definitely give ourselves grace and we move with purpose over urgency. So if you move with purpose and intention over urgency, things would become so much clearer, and then you wouldn't feel guilty when you need to celebrate your small wins or give yourself a break or just breathe, right? And be mindful of just who you are and in this space and having just being grateful that you're able to do this work. Right? Because there's so many of us who aren't able, who don't have the understanding, who don't have definitely not the passion and the vision to be able to be in these spaces. And so we have to be grateful for the privilege that we have to be in this type of field. That's
awesome. Purpose over urgency. I think That is great. That could be put on a t-shirt, on a car sticker, on pretty much anything. Public health, let's move in purpose over urgency, because those changes are long lasting when we're moving in purpose. So thank you so much for your time today, Dr. Baker. Thank you for allowing us to put you in the hot seat and sharing your insights today. This was wonderful.
Oh, I enjoyed myself thoroughly, y'all. So thank y'all for those questions.
Thank you so much, Dr. Baker. That is very, very inspiring, right on time for me.
Good. Well, I'm glad.
Yeah. Thank you so much for choosing us as Action Lab Fellows, and such a great exposure and a good learning curve for me and both Ariana. So thank you so, so much.
Awesome. Thank y'all.
Thank you for tuning in to episode 3 of the Beyond Boundaries, the Action Lab podcast. We truly hope you enjoyed this episode, and we hope you tune in to future episodes as they come. Thank you.